My name is Vikki Casanave. Going on my 13th year of nursing. The biggest part of my background is in the emergency department. I worked in the ER for 11 years, full-time, and loved that fast pace. However, I decided to change it up a little bit a year or two ago, and I currently am working in a post-surgical unit. It's a short stay unit. So we get patients who have obviously just had surgery. They're there for 24 hours or less. So there's a lot of discharge teaching, medication management, that sort of thing that goes into their care. And it's a very rapid turnover to get those patients discharged and ready for the next surgical patients coming that day. I also work part-time for an urgent care here in my area in Raleigh. And that's something I've just recently started doing, but am loving that as it's similar to the emergency department type patient types and a lot of variety, but not quite as stressful as all of the ER experiences. On the leadership questionnaire, I scored high as a Democratic leader. I think I probably have the best example of a strong Democratic leader with my current manager. She's extremely supportive. She was very welcoming to me when I came into the urgent care setting. In fact, she worked hard just to create a casual position so that she could take me into her department. And she has continued to be supportive, both of education goals, flexibility with our scheduling, etc. And caring is definitely at the top of the list to describe her. As far as a negative experience I had with a manager a couple of years ago, I was actually diagnosed with cancer and had to step out of bedside nursing for about a year so I could go through some cancer treatments. And 3 days after my diagnosis, I had a manager who I had been working for 10 years at that time. And she called me 3 days after my diagnosis to let me know when my FMLA expired, that she would be able to post my job for someone else to fill my position. So completely lack of support with my situation at that time, and her communication with me never really changed after that. My short-term goal is definitely to complete this BSN program. I would like to do so in the next 12 to 18 months. And my long-term goal would be, once obtaining that BSN, that would open up some doors, hopefully. I would really like to go into an educator role, possibly within the urgent care setting, or maybe in the surgical PACU situation where I also work. So nice to meet all of you. I look forward to getting to know some of you better, and have a great semester. Thanks. Bye.